Remarkable to me is that such a disparate group of people could come together on a workable consensus. My son said that having Senator Kennedy and me together like this on this stage behind the same piece of landmark legislation will help slow global warming. That's because hell is frozen over.
Welcome back to Hardball. That was Massachusetts Governor Mitt Romney having a little fun this morning at a big ceremony to sign into law a bill that would bring health care coverage to everyone in his state. Will it work? Would it work in 49 other states? It's a tall order and just the kind of accomplishment that could turn heads if the governor decides to run for president in 2008. He's halfway there already after he decided not to run for a second term as governor of Massachusetts. He's with us now live from Boston, Governor Mitt Romney. Thank you, sir. Let me ask you about something I'm very impressed with, and everybody else will be, I think, and that's what you've been able to accomplish up there with health care. Everybody wants health care for people who are working, playing hard, and playing by the rules, and trying to raise families and not having enough money to pay for expensive health care. Will the Massachusetts effort that you've just signed now, will it work for the country?
Well, it'll work for Massachusetts, and that's, of course, the thing that I had to focus on. There are certain aspects of it that I think would work across the country, perhaps better in some states than others. Of course, the great thing about federalism is that you let a state try it and see how it works before you spread it out. But there's some key features. I think this is one of them, which is that we are already spending billions of dollars in our country, and in my state, about $1 billion, giving free care to people who don't have insurance. And the question was, if we took that money and helped them buy insurance, could we have everybody insured? And the answer is yes. We don't need new money. We don't need new taxes. We could use the money we're currently spending and get people better health care without having the burden and the cost of the uninsured being borne by everybody else.
So people below the poverty line are covered by Medicaid. People who have good jobs and good contracts, employment contracts, have health care. The people in the middle, the people who are freelance in the business I'm in right now, television, freelance people don't get health insurance. People that are above the poverty line don't get the advantage of Medicare Medicaid unless they impoverish themselves. Is there enough money in saving from emergency rooms and other costs to cover the cost of that middle of the road person who's somewhere between the poverty level and well off?
Well, that's what we found. We studied at some length the people who didn't have insurance, and we found, first of all, that about 40% of those that don't have insurance had plenty of income to buy their own private policy if it were reasonably priced. So we stripped out some mandates. We allowed co-pays and deductibles that are larger, and those people can buy insurance. Then those that are lower income, we found that we're already spending more than enough money to help subsidize the purchase of private
God, it sounds wonderful. Plans. I'm not supposed to cheer here, but I mean, I think it's wonderful. I mean, if it works fiscally, now how long will it take you, Governor, in the Commonwealth to know if the numbers add up?
Well, we'll probably know what kind of a financial experience we're seeing within the next probably year. It's going to take us about 3 years to get all of our citizens insured, but we're going to see the kind of effect that this change has on our individual citizens' lives really very, very quickly. And there's not much question here. It works. As long as we politicians don't get back into the soup and muddy things up, it will work because we're basically helping people get private policies.
Why are the Dems fighting you on this?
They're not. The Democrats and the Republicans have come together on this.
Well, who's this guy out there complaining right now about the fact that you deleted this penalty box of $2.95 if you don't join up?
Oh, that's not a big matter. My Democratic friends added basically about a $20 a month charge to companies that don't provide insurance to their employees, but $20 is not a big figure. I just don't think we need to add any kind of fees at this point, so I vetoed that. But most likely the legislature will put that back in. But that's not the key feature.
So if you can afford it, you buy the insurance under this new plan. If you can't afford it, your copay is still there. You still have to pay a part of it, right?
Well, if you can't afford insurance,
if you can't afford anything, then the government pays for it.
If you can't afford anything, then we help subsidize the purchase of your insurance plan. So let's say you're earning 2 times federal poverty, which in my state would be roughly $35,000 a year. In that case, you're going to be paying about $15 a week for your insurance. We'll pick up the remainder. And so the state picks up some portion of the insurance premium to make sure that everybody has a plan they can afford.
Okay. Sounds like great news, Governor. Congratulations. I hope the numbers add up because it sounds like something we really need in this country.